Blood culture bottles come in 3 varieties: anaerobic, meaning without air, aerobic, meaning with air, and pediatric. Aerobic bottles are generally colored blue and will cover organisms that grow in normal oxygen environments. Anaerobic bottles are generally colored red and will cover organisms that grow in low oxygen environments. Blood cultures are always collected in sets containing both aerobic and anaerobic bottles, except in situations where a pediatric bottle is required. Additionally, they are usually collected times 2. This would mean a total of 4 bottles. If the patient has a central venous catheter, such as a PICC or subclavian line, or a life port, one of these sets should be collected from the line, as the physician may be looking for signs of contamination in the device itself. If not, the sets should be collected from 2 different sites, preferably from different arms, 5 minutes apart. Special care should be paid to the volume inserted into each bottle. Inadequately filling a bottle can lead to a false negative, wherein the patient is actually septic but falsely reported negative. Overfilling of bottles can cause false positives, wherein the patient has no blood-borne infection but can inaccurately be reported as positive. Please refer to the manufacturer's product inserts for appropriate fill volumes for each bottle type. If your draw is insufficient for adult bottles, or if your patient is pediatric, you will use a pediatric bottle for collection. Pediatric bottles generally contain an ARD, or antibiotic removal device. This looks like a mix of charcoal in the bottle with the broth. When preparing the site for collection, it is important that the site remains sterile throughout the collection. Generally, you will use chlorhexidine unless the patient has an allergy or is under 60 days of age. It is vital to never use chlorhexidine on anyone under 60 days of age, as it can be toxic to the patient. Your draw is performed as you would any other syringe collection, with special care not to repalpate or in any other way contaminate the site. After collection, safety the needle and exchange it for a clean needle. When inserting the needle into the bottle, do not use your hand to steady the bottle, as the bottle could tip and expose you to a needle exposure. You may utilize your hand to steady the bottle when removing the needle. Thoroughly mix the contents of the bottle after filling. Thank you for watching the WNC LTE video on blood culture collection.